cashless welfare card. The government in the end had to back down. There's an ongoing trial for 4 regions across Australia. Would this be the sort of thing that should be across Australia? I mean, you're a senator for New South Wales. If this works well in these communities, wouldn't it work well everywhere?
Well, I travel around my state, and I've just come back from the Central West, where I've been to towns like Burke and Brewarrina and Coonamble, where I've met with majority majority Indigenous communities. And these are the sort of issues that I'll be happy to raise with them next time I go back. I think it would be a mistake to see this as a reform which is designed for any particular Australian, but given how much of the opposition's rhetoric has been around presenting this card as something that is focused on Indigenous Australians, I think that, given you've asked me what I would do in my role, it is something that I will take back and ask people in Redfern, people in La Perouse, people in the Central West, whether or not this would be a reform that they would like to see in their communities. I think it's got to be driven by the communities.
Well, but what does that mean exactly? Do they get a vote on it? Does the community of Ceduna get a vote on it, or Bundaberg? Is it the people that... How does that work?
Well, it's community consultation, and you can speak to elders, you can speak to land councils, you can speak to community leaders in non-Indigenous communities. You can do all sorts of consultative mechanisms to determine whether or not that is a card that people think would improve people's lives on the ground. I mean, Australia is a big country, communities are different. My sense is it's a good option to have if people want it.
So you think it should be a community by community a view on whether they have it or not, and if they agree they get it? So is that what, per electorate, per town? How does that work? And how do you assess community sentiment?
Well, I mean, I formed a strong view that a lot of the policy that we do in Canberra isn't sufficiently grounded in communities, and I think that we can do more community engagement.
But how do you gauge that? Is it anecdotal? You go around and you say, "I've been here. Most people love it. We're rolling it out."
Well, there's a system that the department can put in place through the executive government to formalise that. But you're asking me my view
what system?
how I would do it.
I'm just not quite sure. You're saying there's some sort of vote. How do you formalise sort of sentiment and say...
Well, I mean, ultimately, the people that are elected to this place have to make a judgment they're prepared to go and argue for in the public square,
Right.
Tom. But I think that the consultation that you can do on the ground across our country on measures like this is a very important part of it. So if you're asking me what I would do, I would be consulting widely and determining whether or not there is an interest in having this measure.
I understand your point. I'm just not
point.
sure how that works. I'm not sure how you're saying that works. How do you know community sentiment? What if it's
because
right?
you go out to communities and meet with them. You get out of the Canberra bubble,
Sure,
and you go meet with
people.
people.
I understand that, but how do you then go, right, this community is 52-48, they're for it?
Well, as I said, ultimately the people that are elected to this place have got to be able to stand up and make judgments and defend them in the public square.
So would
they should be informed by a range of evidence, including meeting with people.
So what happens? Each local MP comes back and says, my community's for it, someone else says mine's against it, and that's how you roll out the scheme?
Well, why not?
Well, I don't know. Is that how you'd say it could work?
Why not? I think there's a lot of people in this place that are well connected to their communities and they could help us.
What do you think of that idea, Matt?
Well, we don't support it. There's no evidence that this card works, and that's the big issue with it. There have been several evaluations and studies, and there's no clear evidence that it produces the outcomes for which the government introduced it, and that is to try and reduce alcohol and drug dependence, to try and improve health outcomes in particular communities. And that was highlighted by the member for Bass in her speech to the House of Representatives, where she said that she didn't support it. It's a little disappointing that she didn't go and vote that way, but there's no evidence that it works, and unless there's evidence that it works, we won't support it.
Well, that's the key bit. So the government's being pushed now by Rex Patrick. Empirical evidence he wants, for example, in Ceduna within his state. If that comes back, would Labor look at the evidence and be open to supporting it if it has really good benefits for, say, children, abuse rates, domestic violence, gambling rates?
Well, when the legislation was introduced, we consulted with communities, and the view of communities was that this was a punitive measure and that it wasn't necessary. And then that was backed up by the evaluations and the evidence. So I don't think that we will be taking that approach.
Hang on, so you said we need the evidence. If the evidence comes, it's still a no. Is that what you're saying?
Well, because the evidence has come. The evidence has been through the evaluations that have been made, and I've read some of them. One of them was from the University of New South Wales in my electorate, and they came to the conclusion that the card didn't work.
But there has been different studies done, different levels of evidence. I'm talking about something comprehensive that drills into what it's supposed to do, as you mentioned, around crime, around gambling, around abuse and so on. If the government actually does something comprehensive, would Labor at least be open to looking at that?
Well, the government would have to present something to us, and of course we'll consider something in the future.
So you are open to evidence?
No, I'm not going to say that I'm open to something.
But open to looking at evidence?
Well, we always assess programs on the evidence, but at the moment the evidence is that it doesn't work, and on that basis Labor has decided to vote against it, and I can't see that changing.